So Chris, we're seeing Sam and his mother Heidi next. What can you tell me about Sam?
Yeah, okay. Well, Sam is a 4-year-old boy who has been sent to us by a referral from his local GP. On the referral here, it states that he has difficulty hopping, jumping, and that he has low muscle tone. It also says that he has poor balance and that the Kindy teacher has raised some concerns about this with his mum Heidi.
Okay.
Also, there is no reported past medical or surgical history of significance, and he is not on any medication.
Okay, great. So how would you like to structure your session with Sam?
Well, maybe I could get you to play on the mat with Sam while I have a chat with Mum.
Yeah, that sounds fine.
Yeah, cool. I think from there, and talking with Heidi, I'll be able to work out sort of his issues and then go through my objective exam.
Okay. Is there any standardised assessments that you think you'd like to use?
Because he's 4 years old, I could go with either a movement ABC or the NSMDA.
Yeah, they sound appropriate. Have you thought about any questions you might like to ask Heidi?
Well, I want to find out what her concerns and thoughts are on the referral and sort of Sam and how that affects him at Kindy. I'm looking to get a brief developmental history. Then I kind of want to ask Heidi about how he's going now and then like what he likes to do, like what he likes to play.
So you talked about the movement ABC and the NSMDA. Do either of them have a sensory component?
I think the NSMDA does.
Yeah, so how would you like to plan for your objective assessment?
Well, based on like Mum's responses from my questions, I guess if there appears to be any sensory difficulties, then that would be put under NSMDA.
Yeah, that's a fair comment.
Would I be able to confirm with you before I start the objective?
Sure.
Cool.
And are you ready to start now, or you got any other questions?
No, that's cool. I'll just go get the assessment kits from my desk and prepare the room.
Great. I've spoken to Heidi and she's happy for a student assessment today with Sam, so let's go get started.
Cool.
Hi Heidi, hi Sam, my name's Chris and I'm a final year physiotherapy student and this is my clinical educator Kate.
Hi, nice to meet you both.
Ready to play some games with me today, mate?
Yeah, that sounds fun.
Sam, why don't you play with his toys over here while I have a quick chat to Mum?
Yeah, you want to go over there?
Good boy.
Play with you.
Hi Heidi, so this is going to take about an hour today and we should be able to sum it up all at the end. So your GP has referred Sam here today because his Kindy teacher's had some concerns.
Yeah, the Kindy teacher told me that apparently Sam has a lot of trouble sitting still, like when they're sitting on the mat in quiet time. And apparently also he's a bit behind with his cutting and drawing skills, but little boys don't really like that stuff anyway.
Do you have any other thoughts or concerns?
Well, I guess I've always noticed that he's a bit clumsier than the other children.
Yeah.
And I thought that he'd be able to dress himself by now, which he's not. And one of my other concerns is that he's a really fussy eater. It's really, really difficult to introduce new foods.
Yeah. So does he play outside at all?
He does, but he's more of an indoors kid. He loves to stay inside and play with me. His dad, Brian, is a jazz musician, so he really loves music as well. I guess we've tried to do the normal boy stuff, like playing with balls and things, but he doesn't really like it. What else do we do? Well, we go to the playground as well, but and he seems quite frightened, particularly climbing up too high or going down the slide as well.
So do you think that higher activities like climbing and the slide might be a bit scary for Sam?
Yeah, I think so. He does seem to find them tricky and I think he's scared, yeah.
So does Sam enjoy playing, rough and tumble with Dad and the brothers at all?
Not really. I guess Brian's not really a rough and tumble kind of dad. As I said, he's a musician, so they mostly do that together. But I guess now you mention it, I have sort of noticed Sam does tend to kind of slam himself into me at times, so he can be a bit rough. Unfortunately, he doesn't really play that much with his brothers because they're older, so they're mostly on their outfits.
That's fair enough. And before you said he was a fussy eater.
Yeah, it's really hard to introduce any new foods. It's a real challenge and it seems to take a lot of bribery as well. I don't know, it's almost like he just doesn't like the texture of in his mouth of new foods.
Yep. Okay, well thanks for that. I might do some assessment with Sam now.
Was there anything else you'd like to ask about maybe Sam's birth history and development?
Oh, yeah. Heidi, I'm just going to do some questions about Sam's birth history and development. Was he born at term?
Yeah, he was, but unfortunately we had to have a cesarean because it was breech.
Yeah. Was there any problems during either the pregnancy or delivery?
No.
Okay. Do you like playing on his tummy?
Well, not really, but we did keep trying.
Okay. When did he roll?
Oh, I think it was about 7 months.
Okay. And did he crawl at all?
No, he didn't actually. He sort of shuffled around on his bottom for a while and then he kind of just started standing up.
Okay. And whenabouts did he walk?
Oh, it was a bit later. I think it was about 18 months.
Okay, well, it looks as if that's all the questions for now. I might go ahead and do my assessment code.
Sure. Which assessment were you thinking of doing?
The NSMDA.
Okay, why just think that one?
Well, it seems as if he's having some sensory difficulties.
Sure, that sounds reasonable. Let's get started.
Okay, so Sam, just join me on the mat here. We're going to play some games for a bit.
Sounds fun, buddy.
Okay. So I'll just have you sit down there for me. Okay. Now, we're going to follow the bird, okay? You ready to follow the bird? Alright. Good boy. Alright, now you have a go. You have a go trying to make the bird fly. Alright, good boy. That's it. Now, your mum looks as if she wants a necklace. Do you want to make her a necklace?
Oh, I would love a necklace, Sam.
Beads in here. So, let's make her a new necklace, huh? So just with these.
One here.
One left, just to hold it there. Alright, so with these, I want you to thread these on there. And I'll make a necklace for Mum, okay? So can you give that a go? Throwing the beads.
Great job, Sam.
Good boy, you're doing well. Making a lovely necklace. Mum's going to really like this one.
Yeah, I'm looking forward to wearing it.
Good boy. Only a couple more pieces to go.
Can you come and put that on me, Sam? Oh, thanks. We try it on. How does it look?
Good.
Alright, now, so you ready to throw the ball and catch it with me? I'll just get you standing up over here. Come on, Sam. Good boy. Alright?
You stand up.
I'm just
Sam.
going to kneel so I'm on the same height as you, alright?
Stand up. Good job.
Alright, I'm going to throw it now. Oh, good catch, big throw. Oh, good boy. Strong arm on you. Yep. Great, good boy. Just jump over here with me. Good, good. I'm just going to see what's next on the repertoire. Okay. Now, can you help me out with this one?
Ah, yeah, sure.
I just need you to hold this one out. And now, hey, now Sam, I'm going to need you to help me lay this one out flat. Okay? Make it flat, make it flat. Good boy. Now Sam, can you start here and then I want you to tightrope walk over to your mum for me. So tightrope
Stand
walk,
up.
just along the line.
Oh, man, you've got to walk on the line.
Now just
like
try it on the
circus.
line. Back to me, buddy. Good boy.
Good job.
Great, good job. Now just hop on the mat.
Good job.
That was tricky.
Good boy. Now, how about we do some jumping? Can you do some jumping with me? Good boy. Big jumps, okay? Good boy. A couple more. Wow, that was really good standing and hopping on one leg, Sam. Now, I'm just going to pick you up for a little bit and test some other stuff, okay? Good boy. Alright? To the side, to the side, to the front, to the back. Good boy. A couple more. Hooey! Hoop. Hooey! Alright. Back to the ground. Oh, wait. Whoop. Good boy. Great. Now just come over on the mat, Sam. I've got some other things for you. I'm going to check out those big long legs of yours. Okay? So just lie on your back. Good boy. That's a boy. Thanks, Olivia.
So your legs are facing Chris.
Good boy. Right? Now you're on an imaginary bicycle, okay? Let your legs move. Good boy. Ooh, good boy. Now I'm going to move to your arms. Okay.
Jelly arm.
Jelly arms. Ah, good boy. These are really jelly arms.
Oh, you got me.
Ooh. Great. Good boy. Sit up. Boy, that's a boy.
Good job.
Now I need you to follow what I do, okay? So, thumbs up. Good boy. No peeking, no peeking. You're going to follow what my hand does, okay? So, hands under there. Do that. Do that. And that. Good boy.
That's a bit tricky, isn't it? That might be an older one.
Oh, okay. Yeah. Okay, now can I get you to shut your eyes for me? Now you're going to tell me where I touch you, okay? Can you point to it? Oh, good boy. Look at that one. Good boy. Great, good boy. Okay, Sam, that was really good. Now we're just going to move on to a couple more things.
We're just running out of time, Chris. So maybe we can save them for next time.
Yeah, sure.
Yeah.
What do you reckon?
So maybe if you want to talk to Heidi and I'll play with Sam.
Yeah, absolutely. Okay, so that assessment just shows that Sam, he needs help in a couple of areas, mainly to do with his balance is not as mature as it should be. He has trouble hopping, standing on one foot, and jumping was a bit tricky for him, as well as the hand positions. He was having a bit of trouble with them.
Yeah, I did see that.
Yeah. He was a bit nervous about going in the air, so that does fit in with him not wanting to climb. Also, I did notice another thing, that his muscles were a bit floppy when you move his arms and legs up and down. I think the doctor mentioned that in the referral also.
Yeah, I did see that, but I didn't really know what it meant. And I did notice he was quite floppy as a baby. Is this something we can
I like the big one.
Yeah, so when you're born, some people do have muscles that are a bit more, you like the bigger ones.
So lots of colours.
It's got more colours.
Yeah,
Yeah.
let Kate talk.
But that's fine. We can do up a program to work on the areas that he's finding difficult.
Okay, yeah, sounds like we have a lot to work on.
Oh, well, there are a few areas to focus on, but I think we can just start with a few sort of simple exercises.
Okay, well, that's good because life is pretty busy.
Yeah, absolutely. Well, I was thinking of maybe doing a block with Sam. Do you reckon that'd be okay?
Yeah, block of therapy once a week for maybe 6 weeks. Would that suit?
Yeah, I guess we can come on in on Kindy Day.
Yeah, cool. And we can work on some specific goals for the next session.
Okay, yeah, that sounds good.
Whoa,
Did you have any other questions, Heidi?
No, that's great, thank you.
No. Well, thanks for coming today, Sam. Thanks for playing.
It was fun, thank you.
So, Chris, how do you think that went?
Yeah, I think it went pretty well. I did miss a couple of things, but from what I gathered, I've got a fairly solid understanding about his difficulties. I still need to score his NSMDA, but I feel from what I saw that he's going to fit into a low to maybe mild deviation range. I think he has some sensory issues and low tone.
Okay, so what is it specifically about Sam?
So his low tone is affecting his posture and core strength. He has decreased proprioception on testing, and his balance is reduced as well.
Okay, so tell me more about his vestibular responses.
He likes to move around a lot.
Yeah, he does. But there's some movements he doesn't like at all, is there?
Yeah, I did notice that. Honestly, I'm not really sure why.
Okay, so you can have a mixed picture where you like to move around, so your system's under-responsive and it needs to be woken up, but then you have some gravitational insecurities. This means you don't really like to be challenged.
Oh, so that's like the climbing and the slides then?
Yeah, so if he feels that they're difficult, he doesn't like to be challenged in those unsafe activities. So what are your plans now?
Yeah, so I gave Mum some activities for Sam's home program. Could you help me book a block of therapy for him? Also, I guess I should send a report to the GP and the Kindy teacher as well as Mum.
Yeah.
Also, would you be able to co-sign my notes?
Yeah, sure. Are there any other allied health team members that you think Sam would benefit from seeing?
Yeah, actually, an OT.
That's a good
definitely
idea.
go over there, but of course we have to get Mum's consent first.
Yeah, and so you're going to send a copy of the program to Mum. Who else could we send the program to?
Program. Oh, the Kindy teacher, of course.
Yeah, great
Yeah.
idea. Okay,
Cool. Yeah, I'll just go clean up the room. Yeah.
sounds good.